The CDC reports widespread flu cases in 40 states. 14 states are seeing high flu levels this year. 10 children have already died from the flu in the second week of this month. That doubles the total number for kids so far this season. Our Dr. David Agus looks at the flu and other health matters in A Short Guide to a Long Life. That's the name of his book. It's published by Simon & Schuster, which, by the way, is a division of CBS. Dr. Agus joins us from Los Angeles, is how it's still called, this morning. Dr. Agus, good to see you. What do you make of the numbers from the CDC this morning?
Good morning, Clarissa, Charlie, and Gail. You know, we hit epidemic proportion, which means greater than 7.2% of deaths in this country are related to the flu. It's going up. It may be leveling off, but you can never tell. The flu season can go all the way to March or May. This year, it's a bad one, though.
How does it compare to last season?
Well, this year it's H1N1, or swine flu, which means it really hits young kids and young adults much more strongly than others. That strain is in the vaccine. Only 40% of people in this country approximately have been vaccinated. So we need to all get out there and get vaccinated. Under the Affordable Care Act, vaccines are covered with no payment at all.
I am just still reeling from this statistic that 10 children have died. What should parents be doing to help protect their children?
Well, I mean, when you get the symptoms of the flu, you need to stay inside, don't go to work, don't spread it to others. But you're right, kids dying of the flu is something that happens with only certain strains, and we really need to pay attention. There's some newer technologies that are going to get exciting, though, that are going to help. Google now has a thing called Flu Trends, where they look at when people search for fever, runny nose, etc., and they can predict the flu weeks before it's reported to the CDC. There's a clinical trial or study at Harvard that's looking at home testing for the flu, because that's where parents will make a big impact. When you can test and say, hey, my child has the flu, call the doctor and get Tamiflu, which will remarkably lessen the symptoms. If your child is sick for a couple of days in a row, more than 3, call the doctor right away. Or if they have trouble breathing at all, call the doctor right away.
Dr. David Agus, you've talked about this before, but how old should you be to get a flu shot? And if you haven't gotten it already, is it too late?
No. So 6 months of age and older, everyone in this country needs to get one. You can get it now. It will still work. You need to get it. It takes about 10 days to become effective. And again, flu season may go all the way to May. So we all got to get up and get out there and get one.
There you go.
Yeah, sign me up.
Yeah, me too.
We
How
are
about
listening.
you, Gail?
We are listening, Charlie.
Okay.
We are listening. Thank you, Dr. Agus.